So you're trying to manage glaucoma and probably some other eye issues at the same time. Doctor's visits can feel like a total mess, right? Well, today, we're going to cut through all of that confusion. It's not about getting more information, it's about asking the right questions to finally get a clear plan for your vision.
Does this sound familiar? It's a feeling so many of us know all too well. You walk into that appointment full of hope, and you walk out just completely lost. Well, today, we're going to break that cycle for good.
And this really gets to the heart of it, doesn't it? Having glaucoma, plus something like cataracts or dry eye, it feels like every condition is screaming for the spotlight. The real challenge for you and your doctor is to figure out which one is the main act today.
Okay, so let's get right into that overlap. The biggest challenge is that your symptoms don't neatly point to just one thing. That creates a ton of noise, making it really, really hard to find the signal, the thing that's actually causing the problem.
Okay, let's just take blurry vision as an example. What could it be? Is it the pressure from your glaucoma? Is your cataract getting worse? Maybe it's just good old-fashioned dry eye. Or, and this is a big one, could it be a side effect from the medications themselves? You see, one symptom, so many possibilities. This is exactly why our questions have to be so much sharper.
So the answer isn't just getting buried in more data. It's about asking these really targeted questions that create clarity, helping you and your doctor pinpoint the real problem we need to solve right now. Let's kick things off with two of the most powerful questions you can ask.
This question is absolutely fundamental. Is the main threat at this moment to your optic nerve, your retina, your lens, and then the critical follow-up? Which test gives us the proof? Is it the OCT scan, the one that measures the thickness of your nerve tissue? Or is it the visual field test that maps out your peripheral vision? And maybe most importantly, what's changed since the last test?
And this is so important because it helps separate what's most annoying from what's most dangerous. Look, your eyes might feel gritty and just awful from dry eye, and that is a huge quality of life issue, no doubt. But at the exact same time, glaucoma could be silently and painlessly causing permanent damage. This question helps focus the entire conversation on what are we treating for comfort and what are we managing to literally save your sight.
And this quote, this is fantastic. It's the perfect mindset to take into every single appointment you have. By all means, treat what makes you uncomfortable, but never confuse that with protecting the function you can never, ever get back.
So with that crucial mindset in place, we're ready. Let's build out your toolkit. These next questions are designed to turn your appointment from just a passive listening session into an active, productive strategy meeting about your vision.
Okay, let's dive into this. Because if you remember only one thing from this entire explainer, please let it be this question. It is, without a doubt, the single most important number you need to know.
Why? Well, think about it. A treatment plan without a target pressure is like trying to lose weight without a scale. You're doing all the work, you're taking the drops, you're showing up to your appointments, but you have no objective way to know if any of it is working. You need a number, not just a vague feeling.
Now, what's brilliant about this slide is the analogy. Normal pressure isn't always safe pressure for you. If your optic nerve is already fragile, that's like driving on a slick, rainy road at night. The posted speed limit might say 55, but you know you need to slow way, way down to be safe. Your target pressure is your personal, safe speed limit.
Okay, here's where it can get really tricky. Sometimes the very drops that are lowering your pressure are also making your dry eye or your surface disease 10 times worse. It is so important to have a frank conversation about these trade-offs so you can find a treatment that works for your whole eye, not just one part of it.
And that leads to this crucial point. Honesty is everything. So is actually sticking to the plan. I mean, if a drop makes your eyes burn like crazy, let's be real, you're going to quietly forget to take it sometimes. It is far, far better to be on a slightly less aggressive medication that you can actually tolerate and use every single day. So, knowing that adherence is key, that brings us to a really big decision point. What's the next move? Do you add more drops? Do you try to simplify what you're already doing? Or is it maybe time to talk about a laser or some other procedure? This simple framework helps you and your doctor figure out the logical next step for you right now. All of these questions, all of this strategy, it all leads to this one final, incredibly powerful action, getting everything from your visit down onto a simple, one-page plan. This is your ticket out of the clinic with total clarity and confidence. And please, don't just take it from me. This little anecdote says it all. You know that feeling of mental static? That constant low-level anxiety where you're just replaying the appointment, wondering if you understood, worrying if you're doing the right thing. Taking 6 extra minutes to write this plan down can eliminate weeks of that noise. It's an investment in your peace of mind.
And this slide brilliantly maps out the path to that clarity. Your one-page plan means just 5 things. 1. Name the primary threats. 2. Lock in your target pressure. That's your magic number. 3. Choose your tool for this round. 4. Define what success actually looks like in the next month or 2. And finally, 5. Know the red flags that mean you need to call before your next scheduled appointment. That's it. That is your roadmap.
So, as we wrap up, the final question isn't for your doctor. It's for you. After your next visit, armed with these questions, what's going to be on your one-page plan? Because taking control of the conversation is the most powerful first step you can take to protect your vision for years to come.